What questions or problems are you working to solve?
I'm working to address several key challenges that I believe are central to the future of pharmacy. First is simply optimizing pharmacy operations. This isn't just about making things faster. It's about making them more effective and ensuring the care we provide is accessible and patient-centered as possible. It's also about ensuring pharmacists have the time they need to spend with patients to discuss their healthcare. One of the significant components of optimizing operations, in my opinion, is the implementation of technology. Throughout my career, I've seen firsthand how technology can transform this profession. Started in this field about 20 years ago, or over 20 years ago, and over the years, I've been fortunate to witness and contribute to some significant advancements, especially advancements that involve technology. For example, pill counting robots have drastically reduced the manual labor required by pharmacy staff. The first pharmacy I ever worked in, every prescription was counted out 5 tablets at a time, which took a long time. Pill counting robots have allowed pharmacists to focus on more clinical tasks, such as patient interaction, consultation, and ensuring accuracy in medication dispensing. I've also been involved in implementing pharmacy locker systems, which have simplified how patients pick up their medications. These systems not only enhance convenience for patients, but also allow pharmacies to manage their workflows more efficiently. They also allow pharmacists to spend more time with patients that need more attention and support. For example, think about a patient that has been taking a thyroid medication for the last decade and has no questions or concerns. Picture them in a pharmacy line behind a patient who's initiating subcutaneous insulin therapy and blood glucose testing for the first time. Providing the option for our thyroid patient to pick up from a prescription locker is a win-win for everyone involved, as that patient doesn't have to wait in line, and our pharmacist does not feel pressured to reduce the time they are spending with the patient who's starting the new complex therapy. Similarly, virtual patient queuing systems have streamlined patient flow within pharmacies, reducing wait times and improving overall patient experience by simply keeping pharmacy lines organized. The use of these technologies all tie back to a central question: how do we leverage technology to free up more time for pharmacists to spend with our patients? And the follow-up to that question is, how do we shape the future of the profession as we integrate technology and create more opportunities for pharmacists to engage directly with patients and advance our clinical scope and responsibilities?
Why have you chosen to pursue this question or problem?
My decision to focus on these challenges is rooted in the understanding that pharmacists possess a comprehensive clinical knowledge base and are amongst the most accessible healthcare professionals in the community. Pharmacists consistently strive to work at the top of their license and enhance their clinical responsibilities. It's essential that these discussions continue and evolve to further advance our profession. I believe we need to create a new role in the profession that is between a pharmacy technician and a pharmacist. Think about physician's assistants in the medical field. If we go back in time not too long ago, we only had physicians and nurses on our care teams. But these new positions have been created to help lighten the workload for physicians. And these new roles support and strengthen the overall healthcare system. I believe the profession of pharmacy should create another role as well. A role called something along the lines of a pharmacist assistant could absorb responsibilities such as final verification of prescriptions, administering immunizations, and overseeing prescription transfers from one pharmacy to another. Certain states are already passing legislation to allow pharmacy technicians to complete some tasks previously only allowed by the pharmacist. This is progress in the right direction. These changes alleviate the workload of pharmacists. It would also create a more dynamic, rewarding, and new career opportunity for pharmacy technicians. This idea may help us work towards mitigating the struggles we have seen with pharmacy technician recruitment and retention throughout the profession in recent years. Let's take a moment to focus on pharmacists in this discussion. We've already seen how changes in clinical responsibility can strengthen the entire healthcare system. For example, when pharmacists began administering immunizations in the late 1990s and early 2000s, it wasn't just about adding another task to the pharmacist's workload. It was about easing the burden on physicians and improving patient access to essential care. Pharmacies are often more accessible in our communities than doctors' offices. One, because there's usually more of them, and two, they normally have extended business hours beyond regular business times. We need to continue this progressive mindset by empowering pharmacists with advanced clinical responsibilities and creating opportunities to enhance patient access to care. But I recognize the introduction of new technologies can raise concerns for pharmacy staff, particularly around job security. And generally speaking, people can be resistant to change. But I've seen great benefits of continuing to accept technology into the profession of pharmacy, and I believe it's the key to elevating and evolving pharmacist and technician roles.
As individuals and collectively as a society, what can we do to help answer the questions or solve these problems?
In today's rapidly evolving healthcare system, the role of pharmacy continues to transform. As I've outlined, we've already seen the impact that technology can have on our daily operations, but we must recognize this is just the beginning of what's possible. Sometimes change is out of our control. The COVID-19 pandemic accelerated the adoption of these technologies and workflows in ways that may have taken years under normal circumstances. Services like free delivery, which were once considered an added convenience, have now become standard offerings in almost every pharmacy. This shift wasn't just about responding to the immediate crisis, it was about rethinking how we deliver care in ways that meet the changing needs of our patients. Consider how companies like Amazon have revolutionized the delivery industry. A few years ago, customers celebrated a 2-day delivery to their front doorstep of almost any item. And now, same-day delivery has become the norm. This is because Amazon made an internal goal to beat their own service standards. There was not another company threatening to take Amazon's share of the market. They took it upon themselves to create new goals to beat their own service standards. Pharmacists must adopt this same spirit and mentality to innovate and evolve as leaders in our profession. So what can we do to help answer or solve these problems? First, as pharmacists, we have a unique understanding of our profession and its potential. I believe it is our responsibility to shape and evolve the evolution of pharmacy and not wait for someone outside of the profession to solve the challenges for us. We must take ownership of our future and lead the way. Second, I ask pharmacists to embrace change and continue to accept technology into the profession with an open mind. I believe technology is the key to separating our time from manual labor and being able to continue to push for more clinical responsibility for pharmacists. I think when reviewing these thoughts, it's important to recognize that this is a collective effort amongst pharmacists. While we can advocate for change within our own organizations, the true impact comes when we unite and work together. We must share our successes, learn from our challenges, and collaborate across disciplines with other healthcare professionals. We must ensure we evolve our roles and ensure legislation evolves as well. By pursuing these goals with the right mindset, we continue to make a lasting impact not only on our patients' lives, but also on the healthcare system as a whole. Finally, I want to thank you, Rola, for inviting me to be a part of the Questions We Pursue series. I appreciate this platform where different leaders can share their thoughts and experiences, and I'm grateful to have the opportunity to be included. Thank you.